I'm Isabel Lloyd and this is my IM section of the OSCE. So I have a patient who's currently going into anaphylaxis, so I'm deciding to give them 0.5 milligrams of adrenaline to help that. Adrenaline is indicated for anaphylaxis. It has no contraindications, but it does have cautions for myocardial ischemia and tachydysarrhythmia. I've asked the patient and she said she doesn't have either of those, so that's fine. So what I'm going to do is first I'm going to do a drug check. So this is definitely adrenaline. Here's the expiration date, the 10th month of 2020, and I'm going to give 5 mils, 0.5 milligrams. I'd give it to a team member to check that. They would check it, it's fine. So I'd say to the patient, I'm going to give you some adrenaline to help with your anaphylaxis. However, some of the things that you may feel are an increased heartbeat, nausea, vomiting, or a sense of just uneasiness, and those are completely normal. Are you okay with me doing that? The patient would consent. So what I'm going to do first is I'm going to either go into the lateral thigh or the deltoid muscle up here. Those are the two best spots, but I'm going to choose the lateral thigh because I have access to that. I'm going to clean, and how I would clean the skin is I start small and get bigger. And now what I'm going to do is I will get my 3 ml syringe and I'm going to get an 18 gauge drawing up needle for my adrenaline that I pre-opened earlier. So I'll do that, pull it out, I'm going to put it down, draw it up. Cool. That's all of it. I'll place it up the right way and just get rid of any air bubbles, just like that. Cool. Then I'm going to use the one-handed technique to get it back in so I don't stab myself. And then I'll take that off. Now, ideally, you would use a 21 to 23 gauge, but we don't have that. We only have 27 gauge. So I get the right size needle. I would put that on. I would pull it out. I would say to the patient, I'm about to give you an injection. You're going to feel a little prick, but that's it. Line it up at a 90-degree angle. I'd do the Z-track technique, so I'd pull the skin tight, line it up, and then into the patient. That's it. Then I'm going to aspirate the needle, so just draw it back a little bit, just to check that there's no blood in there, just in case, you know, I've hit a vein or an artery, which you don't want to do. And then over 5 to 10 seconds, I would slowly draw it down like that. All done. I'd get a gauze, apply some pressure. At this point I'd ask the patient to put a little bit of pressure on there. One hand technique, get rid of it. And so for all of the needles I'd used, so for my 27, my 18 and my used up ampule, in reality I put them into the sharps container, but because we're at a university I am going to reuse them. So I'll just set them aside for now. I would check if it's still bleeding, I would apply a plaster, and then I would just monitor the patient for the next half an hour to see if they start having any adverse reactions or allergic reactions like rashes or swelling of the eyes or just general discomfort. And then I would mark down, probably on my glove with a pen, the amount, so 0.5 milligrams, the time, which I would check on my watch, the dose of adrenaline, the route, and that's all. Thank you.